introduce our speakers. We have 5, co-authors here for the talk. So Susy is going to talk about assessing machine translation in use. This is about Google Translate. Okay, over to you, Susy.
Great, thank you very much, Wayan. And thank you also for scheduling me straight after Carol, because I can see heaps of overlap, strangely enough, between our project and the seeking of advice and negotiation at a crossroad. It's really, there's a lovely synergy. So I'm not here alone, I'm here with Zhengdao, who is also presenting with me from our team. So our project is titled Assessing Machine Translation in Use, and we're looking at the trustworthiness and safety of Google translations in obtaining surgical consent. And in particular, we're looking at seeking surgical consent for cesarean section surgery. So Google Translate, as probably many of you know, is a machine translation app, which you can use on your phone by speaking into it. And then through automatic voice recognition, there is, the words are recognized, they're then translated, and then they're spoken back by the machine to you. So it comes across as a spoken interaction, but at its heart is a written process. And in 2016, Google Translate changed the way that it worked to a neural network machine learning algorithm, which made it suddenly much better. And my colleagues in the ANU Medical School were concerned that Google Translate was being used instead of human interpreters, who are already fairly underused in the Australian context, and that it would prove too seductive and convenient for time-poor clinicians, and that it might become widespread and the norm before it had been properly tested. So this project is an interdisciplinary effort between medicine and applied linguistics to figure out whether or not Google Translate is able to mediate complex, high-stakes interaction. Our team includes medical doctors, one of whom specialises in social sciences of medicine. We have a translation and cross-cultural specialist, Zhengdao, with me, and an interaction specialist and an assessment specialist. In terms of prior research in this area, it's been found that Google Translate is highly convenient and that it's certainly used, especially for out-of-hours care. In terms of its accuracy, it's been found that it may mistranslate complex medical concepts. It may be less effective with non-Western European languages, and it may produce clinically serious errors. Although Google Translate translates written instructions with a very high accuracy, it has also been found that the inaccuracies that occur can lead to significant harm. So our aim is to use various methods, applied linguistics methods, to ask the question, how trustworthy and safe is the informed consent procedure when the interaction is mediated by Google Translate? Okay, so obtaining consent prior to surgical procedures is an especially complex and high stakes type of interaction. It includes many things, but primarily the reason for and the description of the procedure that is to be had, the communication of risks of having or not having the surgery, and responding to the patient's questions and concerns and the particular patient's circumstances. So it's not surprising then that it's difficult for people who are trying to do this in their second language. So before we look at what Google Translate does with this, let's have a little look at the language of risk. So as you can see from this written form, communicating risk involves sometimes the use of numbers and percentages. It uses modal verbs quite liberally, such as bleeding could occur and may require. It includes complex syntactic structures, such as once you've had a C-section, something will happen, or if you have, something will happen. So these complex kinds of sentences, as well as, of course, its own semantic field, so scar tissue and placenta and the like. So how did we go about exploring this? Our method was grounded. We really just sort of put in place a live field trial of Google Translate through role play methodology. So we had four consent interactions, 2 between low English proficiency Indonesian speakers and an obstetrician, and 2 between low English proficiency Chinese speakers and an obstetrician. So they were role plays, but we were, the participants were real obstetricians, 2 different obstetricians, and I should say we gave Google Translate the very best conditions possible because these were both super good communicators, and the Chinese and Indonesian speakers were genuinely low English proficiency as they self-assessed, but they weren't actually pregnant. So the data was immediate, apart from the role plays themselves, we had immediate post-role play interviews with the obstetrician about the efficacy of Google Translate. So we basically just said, how do you think that went? And we had written questionnaire responses in their first languages from the patient participants, to whom we asked also, how do you think that went? We had transcriptions of everything, and of the role plays we had transcriptions and then human back translations of the Google Translate translations. And then later, once all that had happened, we had further interviews with the obstetricians about the back translations. So we showed them what Google Translate had done with their words. And finally, we took the role play transcripts to bilingual doctors who gave us their perspectives on the interactions. And I should also say about the bilingual doctors, these people were very, very expert in the sense that they were expert in 2 languages, as well as having practiced in Indonesian and Chinese, as well as in English. So we were seeking the very best sort of informed perspective that we could. So in our approach was a grounded approach, which we refer to as grounded assessment. We're using naturalistic and contextualized data, and we're asking for multiple perspectives on it, from the obstetricians, the patients, and bilingual doctors. And the analysis has 4 main stages: transcription and back translation, embedding of the data, so putting the role play excerpts and the bilingual doctors' insights together, then coding these in vivo and triangulating the different perspectives all together, and finally identifying the barriers to trustworthiness and safety. So we're taking a kind of deficit perspective to it. There was plenty of things that Google Translate did well, but in terms of working out whether it is capable of these high stakes interactions, we were looking for any barriers. The transcripts, there were 4 of them. They were very long. They were transcribed by native speakers of English, Chinese and Indonesian. And as I said, the Google Translate output was back translated by professional translators. And here's just a little example of a transcript. These were beautifully compiled and partly transcribed using CA, conversation analysis kinds of conventions by Tina Campbell, who I see is here with us. And they really turned out to be works of art and really wonderful things actually to work with, to see if Google Translate was doing a good job. So I'm going to talk about the findings a little bit, and then I'm going to hand over to Zhengdao, who's going to talk through a couple of the Chinese examples. So just in general, we found that the terminology, the way that it dealt with terminology across the two languages wasn't actually that easy to predict. So some more technical terms are not translated accurately. For example, cephalic, ureter, clot, severely disabled, these things didn't come through in the target language. But equally, some more common medical terms were not translated accurately, and some of these were really, really key in the interaction. So, for example, delivery was often construed as dispatch, the meaning of dispatch. Labour was often construed meaning work, and bottom, which was very important in these interactions because the reason posed for surgical consent was breach. So the doctor needed to say bottom, which was often construed as base rather than as bum. And some terms were not appropriately translated. So, for example, vagina in Indonesian was terribly confronting in the interactions, and the bilingual doctor explained that they wouldn't use that term. Just looking at the word bottom here, we see that in the black, the obstetrician has said, because your baby's got its bottom down instead of its head down, and down in the orange, you can see the back translation of what Google Translate did. I believe you come to see us today because, baby, you obtained it from the lower down to the bottom, not below its head. So not terribly clear. And the bilingual doctor informed us that this was actually incorrect and the malposition was not accurately translated. Interestingly, the word breech was fine, but the word bottom, which was used by the obstetrician typically to describe the position, as she said, that would be how I'd normally say it. So I'll now hand over to Zhengdao, who's going to talk through some of the other things we found.
So I will illustrate translation problems with 3 examples concerning the Chinese-English pair. So the first example, which you can see on the slide, this example has to do with the translation of numbers. In line 700, GT translation, the Chinese GT translation reads, the risk is 1,000 or 0.1. So the translation here has dropped inner, 1 in 1,000, so in 1,000, and also dropped percent. So the interestingly, however, somewhere else, the Chinese GT does get 1 in 1,000 right. So I believe that the explanation for this mistranslation has to do with the faulty speech recognition. It's possible that GT doesn't pick up in a more colloquial style, 1 in 1,000, or 0.1%, which the percent becomes quite soft. So elsewhere in the transcripts, we've seen many mistranslations that arise from faulty speech recognition, from both speech recognition of both Chinese and English. So we can perhaps use both number symbols and number words in the written form, in a written text. However, in spoken interaction, speech recognition is an integral part of GT and has to be taken into consideration when we assess the reliability of GT. Okay, the second example illustrates an inherent translation problem between English and Chinese, not just for Google Translate, but also for human translator. English has a very large repertoire of epistemic adjectives and adverbs, such as possible, possibly, probable, probably, likely, etc. And this is a linguistic phenomenon of indicating cultural elaboration, which reflects the emphasis that English speakers placed on objectivity and on separating knowledge, judgment from knowledge, etc. However, this characteristic feature of the English language often causes problems in translation. Many languages simply don't make such nuanced distinctions between, let's say, possible, likely, or probable. The third example illustrates the challenges of complex sentences and a sentence structure for GT. We do expect that Google Translate performs better in the lexical field than in translating sentences. However, in the medical context, the risk for not getting complex structure right is that the stake is very high. Often the complex structures, complex procedures, medical procedures are explained by using sentences, incorporating subordinate sentences, etc. So the Google the line 111, the Chinese back translation here give you an idea that the translation here doesn't get the cause and effect right. This mistranslation suggests that the Google Translator has yet to deal with the more complex sentence structures. It's not on top of it yet. I think that if this original English sentence is rewritten as when you have the cesarean section, we will give you some antibiotics to reduce the chance of infection. Then I think Google Translator may have a higher chance of getting that sentence right. However, in spoken interaction, we often don't have time to plan and to take into many other factors into consideration. So here, just to give you a snapshot of some mistranslations, some different types of mistranslations.
Thanks, Zhengdao. So just one final example for you. At a more discourse level, we see that the negotiations over the risks of caesarean section also fell apart for various reasons. But it became clear, actually for two of the participants, that they were trying to communicate that they had already had a caesarean section surgery, and that this was in fact going to be their second. And this fact is quite important in seeking consent, because it makes a difference to the kind of advice that the doctor would offer for future giving of birth. So as you can see, the back translation here, I would like to confirm in my first caesarean section, I did a vertical cut. So can I do a horizontal cut this time? This comes after the obstetrician has said that she would have a horizontal cut. And Google Translate said, I would like to confirm that my caesarean section is a vertical cut. This time you can cut the cutting, which has become ridiculous enough that it can be sort of disregarded. But this persists because it's a key concern of the patient that she has already had a caesarean section. She says, because when I gave birth the first time I had a vertical cut, can I choose a horizontal cut this time? Which Google Translate says is, because the first time I was born, when the child is cutting, this time to choose a very hot cut can. So obviously, this, there's a very sort of serious problem going on here with the translation, and not helped by the fact that this was attempted 7 times, but for whatever reason, the communication never happened. The bilingual doctor says they're not on the same page, talking about different things. The patient heard that the vertical cut would do less damage. The patient was concerned that a vertical cut, which she already had, would do less damage to the inside organs. And then the doctor was trying to say, it looks better to have a horizontal one. So we also saw in the immediate post-role play feedback that they, we asked the patient how she had felt about the role play in the blue there. She says, I think I understood the overall sentence structure, the causal relationship, the associated sentences, etc., etc. In bold, how much time there needs to be between the first and second caesarean section, and choices in the way to give birth, and horizontal and vertical cut in the caesarean section. So she's left thinking she understood. The obstetrician certainly had no idea that there was a first caesarean. She said, I didn't know that she'd had a previous caesarean in the orange box there. She said, this would change my consent because I was just assuming this was her first child. So the sort of gravest thing that happened, I guess, is the fact that both obstetrician and patient left the consultation believing that they had understood completely what was going on. So just to finish, we found that Google Translate doesn't adequately handle the nuances of spoken discourse and risk language, and that there is, as other studies have found, the possibility of serious omissions and negative consequences. I should say there's plenty of amazing things that Google Translate does, and there's plenty of things that we were really amazed that it was capable of. But the fact of the matter is that medico-legally, if a surgery occurs without consent, it is actually considered assault. We've also found that it's actually not possible to derive rules or guidelines about how to use Google Translate. So, for example, we couldn't say, well, if you just stick to lay language, you should be okay. Or if you just stick to technical language, you should be okay. We can't say, well, if you avoid modals and just use numbers, you should be okay. None of these things really hold across all the needs within the interaction or both languages. Also, as I mentioned, consent has to happen in relation to an individual. So particular concerns of the individual, the particular circumstance of the individual must be taken into consideration in giving consent, such as a prior caesarean section, for instance. And this has been, the subject of legal action. So the translation tool needs to be able to handle negotiations over risk, and it doesn't seem that it can. And finally, we think it's a really good idea to do field trials of socio-technology, not just to sort of take it into the lab or look at it in a decontextualized way, but really give it a good workout. And there's some references. I'd just like to finish with the acknowledgement of the funding for this, and also our amazing support from the medical school, the obstetricians, the bilingual health practitioners, the patients, and the translators and transcribers.
Okay, thank you, Susy and Zhengdao. Now, questions, comments? Do people have comments or questions? Very quiet.
Susy, could I ask a question?
Carol, okay.
Yes.
I wondered about whether, so is this that the hospital or the doctor is trying to save money on getting an interpreter, or they can't get an interpreter, or they're in isolated areas and they can't get an interpreter, and so we need a mechanism for them to be able to use Google Translate? What?
No, it's really more that Google Translate is super available, and if it's, if you're sort of choosing between whether you wait an hour for the interpreter to arrive, or if you go to the sort of fairly minimal bother of setting up an interpreting consultation on the phone, or do you just reach for your phone? I think that the main concern from medical colleagues was it's just too easy, and it just hasn't been properly tested in the wild, as it were. So yeah, not really unusual circumstances at all.
So I suppose my question was, do you have any statistics on how much it's being used, or is it no?
No statistics on that. Quite a bit of, I guess, anecdotal experience, and also it is starting to appear in the literature to some extent. If I can just actually share my screen again, one of the issues I think is that, you know, once Google Translate gets approved, or once it sort of goes through a research process, if it's 80 to 90% accurate, then there's a kind of feeling of, well, why wouldn't you use it? I mean, human translators can make mistakes as well. But out of the last piece of the most recent research in a medical context, this is the kind of discourse that it generated. Google Translate with few significant errors, it can help doctors bridge the, it's not flawless, but it can help. It's mostly accurate. Can they, you know, so it's sort of really only this one headline, I think, points out that, yeah, it's mostly accurate, but its mistakes could be deadly. But, you know, very rarely is that actually highlighted. So if you sort of receive the general information from the health media, you might think, well, okay, why not use it? And so we want to suggest that certainly for high stakes, you wouldn't be using it.
Thank you.
Any other questions? So there is a...
Hello.
Yep.
Hi. Thank you, Susy. I just have I'm having a question in terms of the research methodology, because you were mentioning that this is based on role plays, and then you know, if I heard right, you know, you say that they won't, you know, they are not actually the participants are not actually pregnant. So you know, because you know, I'm thinking that, you know, sometimes if they, you know, participant could, you know, have this kind of experience before, probably they could bring more experiential into the study, which can reflect the real situation better. So in terms of this, how could you manage the role play, you know, to reflect the real situation better?
Yeah, that's a good question. So it's quite true that it's a role play, so they're not really pregnant. But as you heard, you know, they did actually bring a wealth of experience to it. The other thing is, I can certainly testify from personal experience that just because you're in a situation of giving consent for cesarean section doesn't actually mean you know anything about cesarean sections. So, you know, I think that probably these people were fairly good choices, but it was more important for us that we had someone with genuine limited proficiency in English. Otherwise we really wouldn't know, you know, the extent of the issues with Google Translate. The other thing is the obstetricians are real obstetricians. So this is this is actually a kind of ritual activity in some senses. They have steps that they go through every time with all patients, things that they have to communicate. And certainly the negotiations that occurred were very typical negotiations. The other thing to do with methodology that relates to your question is that unlike a lot of other situations where you're about to undergo surgery, typically women who are about to undergo C-section are operating completely normally in their, you know, as is normal for them, linguistically and cognitively. So, you know, if you're undergoing surgery for some other serious thing that's affecting you and causing you pain or whatever, sure, that might not be so realistic in a role play. But for this particular surgery, we were careful to choose a type of surgery that didn't, you know, necessarily mean that you would, under normal circumstances, be somehow acting differently. So we think we gave the role play the best chance it possibly could. The other thing is, you know, just the logistics of getting into hospitals and landing on that moment of surgical consent in a busy doctor's day, and getting consent for the research itself before they undergo consent for the surgery. It's just too big.
Thank you very much. And I just have another quick question from your end. The thing is that, you know, it's for me, it seems to like, you know, the language barrier is reduced. But how about the cultural barrier? Can that be reduced through the Google Translation? Sorry.
Yeah. I think there were certainly some cultural aspects that emerged in the interaction. So, for example, the question of having a blood transfusion, if that was going to be needed, for one of the participants, she said, absolutely not, there's no way I'll have a blood transfusion. And the obstetrician's view was, in fact, that she was, you know, just sort of pretending. But on consultation with the bilingual doctor, who of course was very informed, and also Zhengdao, you know, it was clear that the concern about blood transfusion is very well founded and actually quite typical. There's that aspect of it. The other thing I'd say about the nature of the interaction and the use of Google Translate is this really interesting thing where they come together over the machine and they almost kind of bond over it. You know, the machine turns out these stupid things and it's enjoyable for them. And I have to say that both obstetricians and the patients, they weren't, you know, the Google Translate did a terrible job, but they actually were fine with it. And part of it, I think, was this bonding that came out of them just looking together at the machine and working together at the machine, which removed concern about other aspects of the interaction. And the other interesting thing is, it's not actually an answer to your question, but I find it interesting, is that you can see your words going in. And somehow that tells you that you've been understood. And you can't see your words going into a human's head. Even though in no sense, of course, has this machine actually understood you in the way that a human would understand you. But that sort of, that perception of comprehension is very interesting. And I think that would probably have implications for cultural understanding.
Thank you very much.
Okay, thank you. One final question in the chat by Katrina Hudson. Would you raise your own question or just Susy? Read it?
I thought it was pretty devastating, your findings. What do you think might be the impact of your study, and what's the situation with interpreters?
So I think there's possibly two impacts. One is to, you know, really advise against the use of machines for the more high stakes interactions, because you just can't trust it. And the other implication, I think, is to help Google Translate get better. Because, you know, cross-linguistic interactions in health are just so widespread in the world. And while it's true that Google Translate's ability in the languages of the world is actually comparatively poor compared to how many languages we have and how many are used in multilingual health consultations, we can certainly help Google Translate with things like bottom, you know, and it might be possible in the computer algorithm to override what they say supervise, you know, algorithms. So override certain uses where, you know, if the context appears to be talking about breech or pregnancy, bottom may be bum rather than base, for instance.
Okay, so we are over the time, I suppose, so we have to stop here. So let us thank Susy and her team for this nice talk and topic, interesting, you know, use of technology with a lot of issues. Okay, so thank you again for everybody. So we come to the end of the session for today's symposium.